Health Check is presented by
Island Cancer Center.
Prostate cancer is the most common cancer that affects men, and it is the second leading cause of cancer death in Guam. Unlike most cancers that does not discriminate, according to Cedars-Sinai Urologic Oncology Medical Director Edwin Posadas, prostate cancer does, which means that certain racial groups are at increased risk of prostate cancer. He says men of Chamorro and Filipino descent are disproportionately affected compared to men of other ethnicities. He adds that prostate cancer does run in families, so understanding the medical history of not just your father, but also your mother is very important, as certain genes which you can inherit can increase your risk of developing prostate cancer. Posadas says understanding cancer and fighting it early can be the difference between life and death.
Despite being very common, doesn't always result in a fatal cancer diagnosis. So many men diagnosed will actually have very indolent disease.
One of the most important advances that has come in the past 2 years is a focus on active surveillance. This advance takes men with low-risk prostate cancer and delays and personalizes their intervention so that they do not have to suffer the negative effects of surgery or radiation treatment.
On the flip side of the spectrum, we have a number of new technologies developing to improve our diagnostic capabilities, such as using MRI-guided biopsies for prostate cancer detection, genetic testing. That's done not just on your basic DNA that you inherited from your mother and father, but actually the contents, the DNA and RNA content of the tumors.
He says this unlocks the secrets of what is an aggressive and non-aggressive cancer. According to Posadas, the most exciting thing that is happening is the understanding of biology in cancer, which is changing, so that the drugs used to treat prostate cancer has rocketed in the 21st century.
So that for a man affected by this disease, we have so many more treatment options than we did even 5 years ago.
Cedars-Sinai not only has targeted IMR treatment, but they also have a GPS-like guided therapy, which includes the Varian True Beam setup, but also the Calypso system.
So we can actually watch the prostate move. This is a strategy radiation oncologists are now using to minimize the amount of damage done in the surrounding tissues, because a man's prostate gland will move through the course of the day relative to what his body's doing, and you want those beams to focus right on the tumor and not to hit on the surrounding tissues.
Posadas says that those who catch prostate cancer early, their survival rate is excellent. With a stage 1 prostate cancer, more than 90% of men will survive without any evidence of relapse of disease. But for those men who are caught late, it is unfortunate some cannot be diagnosed as curable, but their lives can be extended for a significant period of time using the new technology and treatment that is now available. But he stresses that the difference maker is whether or not prostate cancer can be found early enough to use surgery or radiation to remove the disease completely. As with all diseases, it is important to eat well and exercise. If you are at risk of prostate cancer as a result of your family history, it is important to see a physician to learn about screening. With this week's Health Check, I'm Jolene Tovis.
Health Check is presented by
Island Cancer Center.